We're at ASCO 2013. I'm Thomas Baldrick along with Tanya M. Wildes, MD. She is Assistant Professor of Medicine at Washington University School of Medicine in St. Louis. Thanks for being here.
Well, thanks for inviting me.
So you're here to talk about your poster on multiple myeloma in older adults. Let me ask you first, why do this study?
Well, multiple myeloma remains an incurable malignancy, and randomized trials have shown that autologous transplant improves overall survival, but these studies were done exclusively in patients under the age of 65. With the median age of multiple myeloma affecting adults over the age of 70, over half of the patients with this disease were not eligible for the trials that showed the superiority of transplant. However, this approach has been increasingly used in older adults, and it appears that it has a tolerability and feasibility similar to younger adults, but we don't know much about its effectiveness. So I undertook this retrospective cohort study of all patients who underwent high-dose therapy and autologous stem cell transplant at our institution from 2000 through 2010 to compare the older adults who did undergo transplant to those who did not.
And what can you tell us about the results you're presenting?
These type of analyses are difficult because there's a lot of reasons why a patient may or may not go to a transplant, many of which may independently impact their prognosis. And so through this study, we tried to address many of those factors. Factors such as patients' performance status or comorbidities may exclude them from transplantation. So controlling for those factors and controlling for the propensity to undergo transplant, we showed that older adults who underwent transplant were 50% less likely to die than patients who did not undergo transplant. Unfortunately, there will be some residual confounding from geriatric factors that we did not measure in this study. Things like functional status in a more refined basis than performance status can give us cognition, social support, and a host of other geriatric factors that weren't included. So I leave my conclusions that there's an association with improved survival, but we can't yet say that it's the transplant itself.
Okay, so what's next in your research with this? Obviously, there's more work to do.
Absolutely. My plan is to proceed with a prospective cohort study of older adults with newly diagnosed multiple myeloma and performing comprehensive geriatric assessment, which includes a very broad look at the health of an older individual, not just looking at factors associated with their multiple myeloma, but in the patient as a whole, things like their comorbid medical conditions, their memory and thinking, their functional status, what activities of their daily life do they need some help with, a history of falls, which can be associated with muscle weakness, very subtle factors that may be influencing their survival. And once we have this very comprehensive look at the health of an older adult, we can then move forward and look at the treatments they've had, select patients who are very similar in a geriatric sense, and then compare the outcomes between patients who did and did not undergo transplant and have a much clearer idea about the effectiveness of the transplant.
Very good. Best of luck. Thanks for stopping by.
Thank you.
Dr. Tanya Wildes, Assistant Professor of Medicine at Washington University School of Medicine in St. Louis, Missouri.